And I think this has been a factor in many large federated states. The Director General has, I think, said this many, many times. Regardless of the effectiveness of the health system, what's really crucial is that there's coherence, cohesion, and across party, all of government, all of society approach, especially in large federated states where communities need to hear a consistent message from leadership at all levels. That message needs to be clear, and governments need to walk the talk of those messages. So I think all countries have struggled, and this is not a phenomenon unique to Brazil. It is difficult in the face of a major crisis to maintain that cohesion, to maintain trust with society, to ensure that governance is driven by science. And these are the factors, the behaviors, and the ethos that drives not a perfect response, but a good response. No response is perfect. It's very difficult to look at any response around the world and say that anyone has got it completely right. But those who've got it better have been those countries that have really worked on a cohesive, clear communication with population, simple messages, and an all-party and all of society approach.
My question is about the initiative from Costa Rica and Chile, and how, if at all, that will be addressed in the World Health Assembly next week, please.
Assembly, which contains several access-related issues, access to health products. So we expect that some of the issues that are being part of the call to action, the Costa Rica call to action, are addressed in the draft resolution as it is, like, for example, the ensuring equitable access, supporting of COVID-related knowledge, lessons learned, experience, best practice. These are part of the resolution as it is at the moment.
Thanks for taking my question. I am just wondering what the situation is in the Middle East. It seems like cases are steadily going up there, and we track that every day, and it seems just wondering how you would characterize that. I understand every country has a different situation, but it would be good to get your comments on that. Thanks so much.
That you may wish to add. There are a number of different dynamics in the Middle East, and the numbers have been relatively stable in the Middle East, but there have been some increases in the Gulf countries. But worryingly, we've seen, for example, increases in cases in places like Yemen. We've seen the introduction of disease into camp and displaced populations in places like Iraq. We've at least one case in a refugee camp. So, and also we've had cases in Syria. The difficulty in many of the Middle Eastern countries, and there's a huge contrast in the Middle East between countries that are relatively wealthy and well provisioned in terms of healthcare, and then countries in which we have huge conflict, fragility, and vulnerability. And the situation, the risks, and the potential impact of this disease is very different in all. It is exceptionally difficult to run essential health services in many countries, particularly in the likes of Yemen, Syria, and Iraq. And the UN is working with governments and partners for years now to try and to sustain those essential services. It is all the more difficult then to respond effectively to the arrival of the disease in many of these situations. Many of the countries are fractured with different zones of control and different health authorities, so often in conflict. And WHO and its partners have to work across lines, across front lines, work cross-border, and it's a very, very dynamic situation. It's a very sensitive situation, and one in which we have to try our best to serve those who are most vulnerable. If we take the case of Yemen, there's a very worrying situation emerging in terms of the number of cases in both the north and the south. And WHO has been working very, very hard in Yemen, despite these difficulties, with our UN partners We've repurposed 26 EOCs across the country, 10 operational in the south, 13 in the north. We've established with the government 4 COVID hotlines. We've repurposed 300 rapid response teams, which were trained